Hello, everybody. Hey, Mare. We missed a couple weeks now, but I'm excited to be back in the studio recording. I feel like all the cool kids have the podcast studios that people actually rent podcast studios
I
to
did
go
not.
to. Yeah, this is like a thing. I mean, it's so cool. Like, would love to get to that level. So if you guys are listening to this, and if you are enjoying rewriting the narrative, please leave a review. I don't know how people end up doing that, but let us know. But here we are. We're back and ready for action, and we're going to be talking about bone health.
Yeah, yeah, and I really like that we're talking about this because I think that so many people just associate. I mean, fuck, like that's what I associated. I associated like I didn't give a shit about bone health. I did not care until something happened that caused me to care. And I mean, respectfully, that's generally the way things are, right?
Right. And yeah, like even as I said it, like we're going to be talking about bone health. I'm like, oh
Uh,
God, that sounds like we're, eighth grade, like bio or, whatever. And it's like the femur attaches to the, like,
yeah,
but no,
exactly.
we're going to be talking about bone mineral density more specifically. We're going to probably be talking about my bone stress injury, which I am very well versed on now after going through that last year in 2024. And always the hormone connection because I mean that's a big part of where this comes up in the women that we work with and consult with and our coaches. So yeah, do you want to kick it off or?
Yeah, I'm actually gonna kick it off a little bit with a personal because what I was realizing when you were talking is you and I have we have similar but different experiences because when I had I had stress fractures, I've broken my foot, I have apparently or I had a fracture like in my spine at one point. When I found out those things, I didn't have the knowledge or the understanding of urgency that you do in your situation and I do now. I truthfully was more concerned with, okay, so this, when I was told, you shouldn't be dancing, you shouldn't be dancing on this for, X many weeks. I was obviously crushed and I was more concerned with that getting to that day that I was allowed to dance. I didn't give a shit about how well it was healing, or I'll be honest, I didn't really care about if it healed. I didn't even know what that meant. No one talked to me about it. I literally just knew that I was told you needed to wait 6 weeks, and I cared about getting to that 6 week mark. And then I was like back at it, and hindsight, I'm like, wow, not an educated approach at all.
And this was in like how old were you? And it was a stress fracture.
Yeah, so I had three stress fractures in my left foot. Um, Three stress fractures in my left foot. I was probably so this is I'm gonna say my senior year of high school. So three stress fractures in my foot. Oddly enough, putting pieces together. I also was not having a regular period. I was not on birth control yet. I had a period maybe once a year, like every 2 weeks, and it would be like for 2 weeks, and then it would be done. And I thought that was great. I mean, fuck yeah. um, Kind of putting all these pieces together. But yeah, so I was a senior. I think I was a senior in high school. I lied. I was a junior in high school because when I was a senior, I actually broke my foot.
You were
I
so
broke.
young. Yeah.
Yeah.
Yeah. Because that's that critical development period for bone.
Yep. I broke my foot. They said because the tendon literally wrapped around, and I don't even remember because I didn't have the knowledge or thought process to even ask questions. So I couldn't even tell you where my stress fractures. I could point to them, but I couldn't tell you what bones they were in. I didn't ask for any imaging.
It sounds like navicular, like metatarsal of some type as far as anatomy goes. And mine was in my calcaneus, so my heel. So we
Yeah.
covered all the bases.
Yeah.
Well, yeah, the reason I was asking about age, is like when we think about like risk factors for bone stress injuries, like low bone mineral density is very much, one of those. Um and it sounds like you were kind of candidate for that, like with just the intensity of your training. And then not having a period. So we know that estrogen levels were probably MIA, which estrogen, you guys, is so huge for bones, bone integrity, bone health, a lot of other things, but we're going to talk about bones on this one. But even tendons, low estrogen, impacts our tendon health. So that kind of goes along with your case. And what was your, like, was that the period or that was prior to like some of the dieting kind of stuff?
Oh no, that was definitely during like major
Okay.
dieting. Yeah, I started, with
I
dance.
assumed, but we know you could lose your period, because the energy demand was higher than what you were intaking, but maybe you just weren't aware.
Nope, 100%. I was unintentionally dieting because I didn't have a concept of nutrition. I started weighing in every single week, when I was like 10 years old. And so I only knew that less was better. We would do basically, have a bagel, and that would be our meal until dinner. We would chew gum because that would make us not hungry. Um, and yeah, during that time, I definitely did not have a regular cycle. It was absolutely because I was, dancing until like 10, 11 at night, touring like through the summers. Like it was definitely, I was not being fueled well, and I had no understanding of fuel. Nobody taught me about that. That's something you and I talk about quite often. So that whole reds was a very real thing. And I was a dancer. I wasn't an athlete per se. I wasn't running track or something like that, but that diet culture was huge. It's pretty wild. And I didn't even know, with regards to like the spinal fracture, like I didn't even know about that until I was required to have a chest X-ray to get one of my first jobs on a cruise ship. And they were like, "Hey, like, did you know that you had this?" And I was like, "No." And even then, do you think anybody talked to me about it? Like, talked to me about being a young female and having all these fractures, or what was my bone density? Did anybody flag that? Absolutely not.
Yeah, and it's interesting because the bones that you had stress fractures in particular are associated with poor like metabolic health and low energy availability.
Yeah.
Same, so that you have your trabecular rich bones and your, which are more like kind of like spongy, and then you have your cortical or more compact bones. And again, like there's just, it is, very interesting once you start learning about like, oh wow, like bones are complicated, and like they're amazing too because we can make them stronger. And at that time you were dancing, but was there any other like cross training or anything like that?
No, it
Which is
was.
so interesting. Like, I feel like it's starting to be more of a thing in like youth athletics and stuff. But, and I'm not like, I'm speaking a little, out of turn here. And I know every program is different, but like, as far as like swimmers, for example, like what programs have them doing, dry land, like weight training, like, or, our soccer players, like, what are those strength and conditioning programs? Like, what does that really entail? Because different things like plyometrics, like lifting heavy weights is so important to build that bone, especially during those critical years. And risk factors for injuries just across the board increase when we are doing the same old, right? So if
Yeah.
you're always dancing, always putting stress like on those little toes, and then you got everything else and have that bone mineral density from the diet, from the lack of weight training, from the low hormones. We kind of create like this perfect storm during a period of our lives when we really should be having like big strong bones and supporting that process during growth and development, because once you get to like like mid 20s, like that, we're kind of trying to catch up now. Like honestly, like that's kind of your window of opportunity. And I know it's like, oh my God, 25. Yeah, 25. Now we can start weight training. We can start working on our improving our hormonal health and improve our bone mineral density, but you got to be intentional about it.
Yeah. It's really interesting that you brought that up specifically because most people don't think that, your 20s. They think that when you're in your late teens, early 20s, like it's just carefree. You don't have to think about anything. And arguably, it's just that those dialogues aren't happening. I think they're starting to happen more, to which I think now, like you mentioned, there is more cross training. It's not that weights make you bulky, and if you're bulky, you can't move, and it's going to bind up your shoulders, and you can't swim. Like I think that narrative is slowly, in some arenas probably is still there, getting out. And then we actually have like a new conversation with regards to like where we were talking about the low energy availability with again these young athletes who are cross training, but they're still not inputting enough. There's not enough nutrients coming in. I wanted to just kind of steer for a second because I do want to make sure we touch on this for you because, like I said, we have similar stories, but also different because you are very aware, way more aware than I was. You actually,
Painfully so.
yeah, you shared before when we did an IG or Facebook Live or something about your first run-in with osteopenia, and it is right in line with this. So when was that for you? Like, how was that determined? And then afterwards, I'll maybe get into some definitions for everybody.
Yeah. So when I was between the ages of, I would say 14 to 21, 14, no, 14 to 20, I struggled with anorexia. And the first time I was in treatment was, oh my God, I can't remember years, but I was 14. I was 14, had my 15th birthday in treatment, and I had a DEXA scan done, and my bones were in a good spot at that point. However, I relapsed. Well, I never really recovered, but I relapsed and was in treatment again. 18, 19, I had my 19th birthday in treatment. And at that time in treatment, they did another DEXA scan. And that's when I found out that I was osteopenic. So I'll let you get into definitions. But yeah, 19 years old, I found out that my bones were deteriorating. And that was a byproduct of the low hormones, low body weight, low energy intake, et cetera, et cetera. Like, and especially during, like I said, the eating disorder started essentially like I had my first period when I was, 14, and then, my eating disorder started. So now we're talking about that hormonal component. Sarah never had hormones essentially.
Yeah. Before I get into definition, I just wanted to pause and just ask you, you were so young and respectfully, you were in it. Like you were in the midst of dealing with this eating disorder. And I know that, your parents were heavily involved. Did you understand, like, did you have a concept and understanding of what that meant when they diagnosed you or said to you, hey, you have osteopenia? Did your parents understand? Did someone say, hey, listen, Sarah, this is what this means now, and this is what this could mean for your future?
Oh yeah. I mean, I remember my parents especially, like even like before that, like just my dad, like always being like, your bones, like your body, like, like just all of that. And I think it hit me more then than it did when I was a little younger as far as like the magnitude of the disease. But I don't think it hit me as much as maybe, you know, like if I had known more, essentially, about like hormonal health and whatnot. And, I was 19. So like, I feel like I would like more 19-year-olds to have the knowledge that I have now. And that's, really, important to me because I do feel like at 19, you can handle that information and you should have that information.
Yeah, I think you said something on a previous podcast. I can't remember which one right now. But you said, we were not dumb. Women aren't dumb. We want to be
Especially me. Like, no offense. Like, I'm just going to toot my own horn. Like, I'm like straight A student over here, like AP classes. Like, give me
yeah,
the information, doc.
yeah. Well, and respectfully, like I love that they did that because like my experience was so different. They literally said, "Yeah, you have three stress fractures. Don't dance for 6 weeks." No one asked me, do you have a period? No one even asked me about my nutrition. They literally said, you have three stress fractures, ice it, and don't dance for 6 weeks. That was my
Yeah.
rehab, my recommendation. So anyway, we'll get into some definitions, and I have this pulled up just for everybody to know. I do not have this perfectly memorized. We're not going to pretend there. I have a pretty good bit to give everybody here. It is important because it can be confusing. So essentially, when we're talking about bone density, we're going to be talking specifically right now about two scores, a T score and a Z score. Okay, I'm going to read the definition here with regards to both. So a T score, quote, is important for measuring your bone health compared to an average 30-year-old. In literature, we look at like a 30-year-old as somebody who is still producing active hormones. They're not postmenopausal. So ultimately at vitality, right? So they're at their best, okay? So a T score, again, is important for measuring bone health compared to an average 30-year-old. The reason you're being measured against an average 30-year-old score is that this is when your bones are at their peak mass. The measurement is known as a SD for standard deviation. If you have the same bone density as an average 30-year-old, your T score will reflect a 0. A Z score, very important, very different. A Z score tells you what your bone density is compared to the average results of the same age and gender, meaning Sarah would be compared to another female of her age, okay? Not somebody who's my age. So this gets really good, in my opinion. If you're a 65-year-old woman, your T score will tell you your bone density test compared to that of a 30-year-old. Your Z score will indicate how your bone density measures against another 65-year-old woman. Very important. So a note that I had written here is a Z score is typically helpful indicator for children, young adults, pre-menopausal women, because it gives your doctor or you a clue that there might be some underlying medical condition if you are having a side effect from medications, if anything is changing. I think that is really important to know who you are being compared to. I arguably think that it's important for example, somebody who is in perimenopause. I really advocate for getting a T score and a Z score because you want to be compared to somebody of your age, but we also have to understand that these scores are based on a population, right? And for arguably a lot of the people that we work with, as far as athletes, we want to be compared to kind of the best of the best, the healthiest of the healthy. And this is also where there is even different recommendations. I even have it quoted somewhere here from the American College of Sports and Medicine. So the American College of Sports and Medicine and the International Olympic Committee, they define normal bone health in athletes from a Z score of over or equal to -1, as opposed to what a healthy population normal Z score would be over or equal to -2. For me, for Sarah, for our human beings, we want to be compared to athletes, to really healthy human beings. I mean, it can be very confusing, but I think when we put things into perspective, when we understand who we're being compared to, that gives us a much better idea of where we really stand.
I love that you brought that up because, yeah, like, because then you can get brushed off, right? Like, so easily. Like,
Yeah.
if you were maybe at that cutoff of like normal, but like not so much like optimal, and, you know, we could be sliding through the cracks, because yes, like we have diagnoses, like we have like criteria for like reds or low energy availability, but like this is a very messed up thought that happens with disordered eating and eating disorders, is that I'm not bad enough.
Yeah.
And I think for women to understand that it's not about waiting, like you always say, like, women will say like, "Oh, well, I don't feel bad." Right? Well, I didn't feel bad either until I cracked a bone, and same for you.
Yeah.
So, like, just because, we don't feel bad, well, a lot of us are great at just, I am above any ill feeling, like any ache or headache. Nope. I power through no matter what. And I always feel good. I always make shit happen because that's who I am. And you may not feel as many feels as maybe someone else, or acknowledge that you're feeling those feels.
Yeah.
Maybe until someone directly asks, like, how's your cognitive functioning? Or, et cetera, et cetera. But yeah, my point is, I think knowing, like, for you and your goals, like what maybe a better target might be, and then taking initiative, taking action. So, you know what really grinds my gears, Mir? So, how do we test this? This is done via a DEXA scan as far as assessing your bone mineral density. Let me ask you, dear listener, when you hear DEXA scan, what do you think?
I'm going to answer fat loss, fat mass.
Fuck that shit.
Yeah.
Excuse my language.
Yeah.
I mark this podcast as explicit for a reason. That pisses me off. And you know why that pisses me off? Because my first, I'm grateful, I guess, that my first introduction to a DEXA scan was my situation with bone mineral density. And I remember like getting older and hearing people talking about like, oh, I'm gonna find out how like fat I am, or how much muscle mass I have. And I'm like, that thing tells you a lot more than that, and maybe some more important information. And, again, like in grad school, like just learning about different body comp, assessment models, like DEXA scans are highly variable as far as, I'm not going to get into that discussion. But anyway, a DEXA scan, I think a more like thinking of it from that bone health perspective and advocating for yourself and your providers, women, before we get to 60 years old to get DEXA scans done, I think is important. And even out of pocket, like I, last year going through my bone stress injury, I requested a follow-up DEXA scan, and my insurance did cover it, or, my copay was fairly low, so it wasn't a big deal. But I did look into out-of-pocket options, and it was only like 100, $200. Like, yeah, I mean, maybe I'm privileged to say that, but like that's cheaper than serum lab work in some cases. It's cheaper than a GI map, and quite honestly, like might be more impactful for somebody than, spending all this money on, whatever the hell, and getting, an insight onto, your bone health and your bone mineral density.
Yeah. Exactly. I think that when we talk about cost, it's really important to also think about how expensive a cost is with regards to a hip fracture. Like for women, once a hip fracture happens, the when it comes to mortality rates, it is not good, my friends. It goes very, very down. Femur fracture, everything goes down, especially as we age. And I think too, this like opens up a really nice, window that we are all individuals. I think that, I had a conversation with somebody today with some really popular physicians on social media and what they're saying, and I said you need to understand something. Instagram gives you, 60 or 1 minute to 3 minutes to have a voice. The average person will listen for 5 seconds, 7 seconds. So there's not a whole lot of context to you as a person. And so, for example, like if Sarah was like, oh, well, they say that you shouldn't test bone mineral density until you're 60. Well, that's not really appropriate for somebody with her history. It wouldn't be appropriate for somebody, number one, if I was not in a surgical menopause, just with regards to my fracture history, it wouldn't be appropriate. But I was lucky that nobody even thought when I went into menopause, nobody even said to me, hey, Mare, you need to make sure that you get a bone mineral density like ASAP because your, bone loss happens like at a much accelerated rate because of the surgical menopause. I was lucky enough to meet with a nurse and she said, you need to have this done like now. Like you're within, 1 year, 2 years of being in menopause. She's like, you need to get this tested. If it was not for her, I wouldn't even thought about that because why? Like I'm not 65. Like my
Right.
doctor was like, yeah, wait till you're in your 60s. Like, well, that's not appropriate.
Well, yeah, and I'm so glad that you did have that provider. And again, like, you bring up Instagram and Reels, like that's why we are so big on education. And I don't care how bad it looks for the algorithm. I had to advocate for that DEXA scan last year. Despite my history, despite, walking into my primary care provider's office, with a MRI showing a crack in my bone, I still had to advocate for a DEXA scan,
Yeah.
which, she didn't push back on, but she was like, why? Like, why do you want that? And I was like, well, so for anyone, listening, last year, like I prepped for a bodybuilding show. So amenorrheic, and then dove into running and that's a whole other podcast. But anyway, I had all of the reasons that we just discussed to push for that DEXA scan.
I do want to take a second here because I think that right there, that moment of just your provider saying to you why, that holds such a weight for the large majority of individuals because it's in that moment that literally shit could go one way or the other. And because it feels uncomfortable, because you have, I'm going to say, arguably somebody who you look at as an authority figure, somebody who perhaps is above us with regards to their education, they're, a doctor. And if they just ask us why, for many, many, many people, they will literally kind of feel like that moment of like, oh, well, maybe instead of thinking, oh, well, this is the reasons why I'd like, they're like, oh, well, their instant thought is, I shouldn't. Oh, they think I shouldn't do this. And well, you don't think it's important? And then I really, and, Sarah encourages our clients, like, just because they ask you why isn't a no. And arguably, if you have a valid reason and you have a concern, if they just one no does not mean no for everybody. And this is where I think a lot of people feel like they shouldn't have to do that extra effort of like paying out of pocket. And you know what? Sarah and I wish you shouldn't either, but guess what? Real world, you do.
Right. And I don't know. It's the best investment you can make is in your health. Like it
Yeah.
is truly the greatest wealth.
I think that, you know, what would you, just for your thoughts, knowing your experience, knowing my experience, if you have a client coming to you who's never had a bone mineral density test and arguably say we're not dealing with any other major, first issues, everything's pretty good. When would you tell your client say she's, in her early 20s, would you say, hey, like, you know what, might be worth when you have the funds or start an envelope, let's maybe make a bone mineral density, like put it on the radar for like the next year, just to have, maybe you don't do another one for 5 fucking years, but just have one. Would you say if you're in your 20s, great idea, or would you say, wait till your 40s? What would you say?
Nope, I would say great idea. Get a baseline.
Same.
That's exactly why we tell people to get serum lab work done, at least once a year, or like before, like, like let's say like 30, 33, 35. Like, let's see where your thyroid's at now. Let's see, where your sex hormones are at now. Um, Again, even if you feel fine, right? Like, I think it's important.
Yeah, I agree too.
And
It's
and you can even say that. I mean, that's how I advocate a lot for myself with my providers is I would really appreciate this, for, with my history, I would like, this middle point with this DEXA scan, we could call it. Like, let's say if my last one was 5 years ago, I would like another one because then I want to compare in another, 5 years. Now, I'm actually planning to get one done this year, but anyway, I think just going into the conversation that I want this for my records, for my health records. Usually it's not the provider, it's insurance, I'm gonna say for the
yeah,
most part. So, I think again, like that is a good way to kind of maybe come at it if somebody tells you why or asks you why.
yeah. It's, especially even with insurance. So we obviously, if you have insurance, we try to get it covered. This is where, be your kind of own detective and advocate. And arguably, if we think about bone health and coming back to this podcast about how important bone health is, you can come up with some pretty fucking good reasons of a rationale on why you need to get a baseline.
Yeah, and god dang it, like if you're going to go spend the money on a body fat and find out your, estimate, whatever and then like, think about it for a year and that I have so many like little like issues with the body fat testing. We should do a whole podcast on that.
Yeah.
Um and I have actually a friend who did some research like in grad school and for her doctorate on it that I might recruit to talk about it. But that's the whole other thing. But anyway, if you're prepared to spend that kind of money on that, like find out your Z score. Like,
Yeah. And if you're, again, I'm going to say probably if you're above 35, I personally would get a T and a Z. Very, kind of a little bit harder, but I definitely would recommend it because I think that once you're getting into like your mid 30s, this is where you have had history and everybody does have a different history. And I think that for me, I want to be compared to that 30-year-old athlete. I have not had an average human being history in life. I have not ever excelled to be average, ever.
right. No, F that. Well, and okay, so go back to that part of the episode, but just to kind of recap. So like the Z score is going to be comparing to like somebody who's, around like 30 years old. And then the T score is going to be comparing to somebody your age.
Oh,
No, I
verse.
said that wrong.
Flip it.
Yeah,
Yeah, flip it. Flip it. Yeah, so
you say it.
Z is comparing same. So someone average your age, average and your same gender. T score is that 30-year-old. So, for example, Sarah as Z score, she's going to be compared to somebody who's similar her age and a female. If she got a T score, it's going to be comparing her to somebody who's 30, which that really wouldn't be super, super appropriate for her. Maybe helpful information. Now, somebody who is, I'm going to say in their 50s, if they are going to get a Z score, they're going to be compared to somebody in their an average person in their 50s who's a female. My ladies, if you are 50, I want your Z score, sure, but I want you compared to that athlete who's in her 30s. And then again, this is where we can go back to, and I'm going to just pull up my quote of the society again. The American College of Sports and the International Olympic Committee, they do use a Z score. So average age, average female. But this also brings to question, like, so what if you have somebody who's done Olympic sports and this person is now in her 50s? Like, fuck, let's compare her to somebody who's in her 30s.
Yes. Amen to that. And yeah, and again, like for an athlete, like they're recommending roughly like 10% higher than, the cutoff for quote normal. And
Yeah.
again, you know how we feel about normal if you're our client or you work with us in any capacity. And I know you guys listening are about so much more than normal too, because what is normal? Like, go to Walmart, go to the beach. Like, we're not about that, right? Like, we're not settling and we're rewriting the narrative. So
Yeah.
on that, I'm gonna wrap this. But we definitely could go in so many other directions and will. So we hope you enjoyed this episode. And be sure to leave a rating review, share it on your stories, bookmark it, send it to your girlfriend who also needs to schedule her DEXA scan. And we'll talk soon.